What is up, everybody? Dr. Kaylee Simmerman here, pelvic floor physical therapist, owner, founder of the Hope Doctors, and lots of other really cool things that are tied to the Hope Doctors. First and foremost, want to share with you, highly recommend this brand of nursing bra. I've been wearing it since I was newly postpartum. We'll drop the link in the show notes, but so comfortable. Literally have been in it all day. Haven't taken it off. Don't plan on it. So definitely recommend that. But today, I wanted to just give you guys a little bit of background and some information on like the meaning behind hope and why I find this is one of the most important things in pelvic floor therapy, but it's also one of the largest like missed things. Like the things that we are known for are the things that other practices or practitioners are not looking at, are not paying attention to. And it's just really important that we get that education out there. So I'm going to talk a little bit about that. So we had a rebranding in 2022 and came up with the name after thinking a ton about what are those emotions and the thoughts that I want our clients to feel when they come and see us, when they come and work with us. I want to see or I want to know like how their experience with us makes them feel, how getting rid of urine leakage makes them feel, how not having pain with sex makes them feel. What does it feel like when you can run after your kids when you're 45 without worrying about finding a bathroom? What about when you go to the trampoline park and you're not worried about embarrassing yourself? So I started to ask clients like how they felt. And one common trend was that we give hope for a better life or to be symptom free or to compete at the level they want to. And that's such a powerful statement because hope in and of itself is such a powerful word if you think about like its meaning, right? And while we are here, let me just pull that up because I think it's important. So when I type in like define hope, hope definition is desire accompanied by expectation of or belief in fulfillment. So we expect to live a good life, right? And we want to be fulfilled. We want to love what we do and what we're doing and being around our kids and enjoying the time that we have. And I think that that's just really important, right? So paying attention to that and giving yourself some understanding of just what that word means is really important. So what I did then was I realized, okay, so like that's the common trend. How can I use hope in our name? Like, what can I do? How can I utilize it? And the next step was putting doctors behind it. And I was trying to decide between docs, doctors, and all the things. And the reason that I have doctors in there is we don't hire clinicians that are not doctors. And the reason is because of that expert level of training that I want our clinicians to have. And I said the in the front of it to make it more bold, more clear, like the Hope Doctors. Like, that's who we are. I'm a Hope Doctor. The end. End of story. But then I took it another level and I wanted to think about like what is an acronym I can think about that would actually tie to either doctors or hope. Came up with the one with hope. So holistic. Again, let's go through what these words mean. Holistic is defined by, it's characterized by the belief that the parts of something are interconnected and can be explained only by reference to the whole. So what I think that that's like, that is such a cool way to define the word holistic. So holistic, we think about holistic health, we think about non-toxic living, low toxic living, all of the things, but we're looking at the whole body. So yes, we're pelvic floor specialists. Yes, we know how to treat incontinence and pelvic organ prolapse and all these other things, but we're also experts in the orthopedic body, right? We know how the body functions, skeletal. We know how things are tied together because it is all interconnected. We cannot treat your pelvic floor without paying attention to your spine, to your shoulders, to your hips, to your feet. We have to look at the whole body. Otherwise, we're going to miss the root cause. So holistic came from that because I think it's really important to remember, again, like everything is connected. And when you come in and work with one of us, or when you work with one of us virtually, you are going to see that. We look from head to toe. We ask you questions about your jaw. We ask about stress management. We ask about trauma. We ask about your movements. We ask about foot and ankle. Like there's a lot of information that we go over, but there's a reason for it. So that's what the H stands for. The O is for ortho. So orthopedic. So definition of orthopedics is the branch of medicine dealing with the correction of deformities of bones or muscles. Orthopedics is the basic knowledge of generalized physical therapy. So we are the experts in movement. We are the experts in joints and the way that the muscles connect with the joints and how the muscles work and how they're supposed to work and how much torque, like there's so much that goes into it, right? But I put that in the name because that also ties into what holistic means, meaning looking at the whole, and it's all connected, but it also gives us the idea that like we were physical therapists before we were pelvic floor specialists. So knowing that, you come in knowing that you're getting someone with experience and expertise in the orthopedic side as well. We know how your body is supposed to function and move and all the things. And so that's where the O comes from. And then pelvic is relating to or situated within the bony pelvis. And so again, like holistic, ortho, HO, and then the P is for pelvic, which is where our expertise lies. Not only do we have our doctorate degree in orthopedic physical therapy, but now we're taking that extra step and we're getting trained and educated in pelvic health. And so that's where our expertise, that's where our specialty lies. And then we go into the E, well, pelvic health in general, by the way, is where we treat things like urinary incontinence, pelvic organ prolapse, diastasis recti, chronic constipation, fecal incontinence, chronic SI joint pain, preparation for labor and delivery. There's so many other things that I can go into, but pelvic health is really anything that ties in that pelvis, right? So we're dealing with reproductive health, sexual health, we're dealing with bladder health, bowel health. It is all something that we have to have that expertise or that expert knowledge in. If you're watching on YouTube, you see my son Bryce coming. So I'm just going to wave so he knows that I'm seeing him. He's probably going to make some faces and some noise. Hi, buddy. And daddy's trying to save the day. Yes, so it's super important to know how those things tie together. So pelvic health in and of itself is that specialty, right? So we're looking at how it all ties together with that. One of our clinicians, Dr. Andrea, she always likes to say that pelvic health is for anyone that poops, pees, and procreates. And it's so true because bowel, bladder, and sexual function are the main things that we're looking at. So when you think about that, then we're going into the E. So now we've gone over holistic, orthopedic, pelvic, and then we're going into experience. Experience is practical contact with and observation of facts or events, or encounter or undergo. So I actually chose for the E of this acronym, I chose the verb, which is the encounter aspect that I just read. And the reason that I chose that one instead of the noun was because I want the experience to be an active process, meaning from the moment you find us on Google, you find us on our website, you find us through this podcast, I want you to feel comfortable, one, talking about these topics that are typically seen as taboo. Like talking about our vulvas and our vaginas and our buttholes are not something that we're all comfortable with. And if you're like me, you were raised in purity culture where you didn't talk about any of it. So I want you to be comfortable from that very first contact. Even if you call in and you talk to our client care coordinator, I want you to be comfortable with her. And then from there, I want you to feel like you know exactly what's going to happen. I want it to be a full experience. I want you to know the next steps. I want you to understand that you have control. I want you to understand the policies we have in place and why. I want you to know where your exercises are, why you're given those exercises, what we have as options for payment, what we have as options for outside of in-person clinical treatment. And I want you to feel heard and seen and, taken care of. And I think that experience is really important. And that's why I always ask for a review after you have seen one of our clinicians. It's important to me to get the word out, to have more people be seen. Because again, like over 80% of people have some form of pelvic floor dysfunction. I would actually say that is skewed and that 100% of us have some form because most of us don't. We just don't talk about it. And we're here to help you. Like our global mission, our big mission within Hope Doctors is to really make this like normal. Like it's normal to get pelvic floor therapy. We want it to be a standard of care When you get your period, go see a therapist or a pelvic floor therapist. When you start to have sex, go see a pelvic therapist. When you are trying to conceive, go see a pelvic therapist. When you're diagnosed with endo, go see a pelvic therapist. When you're diagnosed with chronic constipation, go see a therapist. If you have hemorrhoids, go see pelvic PT. Like, I want this to be a normal thing, and that's our global mission. Our vision is to reach all over the world, which we're starting to, which is super cool. So that's why we are opening up and we have our online academy. That's why we are working on the other things. Like, it's just really important that you understand that we're here to hear you, to validate you, to see you, and to have a place and a safe space to share about your symptoms. But that concludes the episode for today. Nice, short, and sweet. I just really wanted to touch on why that name came about and why it's so important, because again, like, we did the business anniversary for a week and you guys got to hear a little bit about the Hope Doctors and kind of the journey of it, but now I want to really get into that nitty gritty. And so, like, every other week when we launch an episode, I want you to know, like, where that is being stood, like, what do we stand for? And that's really what it is, right? Like, we're going to stand for bringing you the best information that we can, whether that's by us, whether that's by an expert. So I can't wait to make sure, or I can't wait to record the next episode. Please be sure to hit subscribe, follow, make sure you share with your friends, send in any requests that you have, and I look forward to seeing you in a few weeks.